For the FMS testing, we're going to be doing the active straight leg raise. So I'm going to tell the patient or the client to lay flat with the back of their knees against the 2x6 board with their toes pointing up. And then I'm going to tell them to put both hands with the palms facing up next to their body. And then I have the dowel, which I'm going to place. It's going to help us with scoring. So this is going to be between the midline of the ASIS and the patella. And then what I'm going to tell her to do is to pull her toes up against, like she's pulling up towards her chin. And then while she keeps the back of her left foot in contact with the board, she's going to keep her right leg straight and bring it up towards her as high as possible. Yep. And then with this, I assess where it's at compared to the dowel. And right now she's pretty much in midline, a little bit past it. And then go ahead and bring her down. And so we would also test the left side. We can do that real quick. The dowel in place. Yep. And then go ahead and bring this leg up. Same way. Perfect. Okay, go ahead and bring it down. And then the purpose of this test is to assess the active hamstring gastrocsoleus flexibility while maintaining her stable pelvis and active extension, and then also the ability to dissociate the lower extremity from the trunk while maintaining stability in the torso. So for scoring, she would get a 1 if the ankle lined up below the mid-patellar joint line, so if it was behind the dowel. So this would be a 1. A 2 would be with the ankle just outside of the dowel here. And then a 3, which is where Allie was, is past the dowel. And so from this, we noticed that if a patient were to get a 1 or a 2, then we would assume that they have poor trunk control or stability. And so we would come up with an exercise to help them fix this.
So our exercise that we are going to be doing is the active leg lowering to the bolster. So I'm going to put the bolster on the treatment table, and then I'm going to have her laying across, and this is to help improve hip mobility and stability for the active straight leg raise pattern. And what I'm going to have her do is to bend both of her legs. Yep, perfect. And then bring with your hands beside you and face up. Now I'm going to have you bring both your legs straight up. Yep, very good. And then depending on the affected leg, then I would just gradually have you lower, say it was this leg, so gradually lower and come up. And I would have her do this as her exercise to send her home, and this will help her with the active straight leg raise, and we would work from there.